Depression in adolescence is a major issue. In the U.S., suicide among teens is the second leading cause of death. These teens are ranging from ages 15 to 19. 1 in 5 teens consider suicide. A vast 60 to 80% of children and adolescents with depression are undiagnosed and untreated. Majority of these patients are first presenting in a primary care setting where an advanced nurse practitioner can make a huge difference. The significance of this project is a potentially healthy future is depending on appropriately diagnosing and treating depression. We need to apply successful interventions to our youth that are depressed to help fix this issue. My project focuses on the COPE intervention. COPE stands for Creating Opportunities for Personal Empowerment. This uses CBT, cognitive behavioral therapy, by implementing the following: educational sessions of healthy lifestyles, strategies to help build self-esteem. It includes 20 minutes of physical activity every session for confidence building. We do goal setting, effective communication, nutrition, and this is done through a series of sessions by role-playing, case-based examples, journal logs, reflection series, and homework assignments. Multiple studies have been done over COPE so far. Most have taken place in high schools, and one has taken place in an outpatient clinic. All of these studies have used the Beck's Depression Inventory to measure their results, which is a very valid tool created by Pearson and known to be very effective. All of the studies have shown very, very positive results in COPE has shown decreased levels in depression, anxiety, and stress levels. Parents have also seen the difference in students and commented how helpful COPE has been. The focus of the project is to decrease depression symptoms in adolescents by implementing the COPE method in high school health class. The purpose is to study the effectiveness of COPE method on adolescents with depressive symptoms. The goals are to first conduct a pre-test to screen adolescents in junior health class to find the depressive symptoms and feelings. Then COPE method will be implemented for 1 semester in this high school health class. Then there will be a post-test following that semester-long COPE session to see if anything has been effective with the method and the depressive symptoms have decreased. Then there will take some time to interpret the data and results from this project. The tool of measurement will also be the Beck's Depression Inventory, since this is the standard method of measurement for the COPE project. This has a set of 4 possible responses ranging in intensity. So for example, I do not feel sad, I feel sad. I am sad all the time and I can't snap out of it. I am so sad or unhappy that I can't stand it. Each answer gets a score ranging from 0 to 3. The higher the student's total is, the higher or the more depressed the student is. They will also be used as a post-COPE parent and student evaluation to see how they really feel about the COPE study and to share personal experiences. The project design is a quasi-experimental with 1 group, pre-test and post-test. It uses a large high school located in Richmond, Kentucky. The target population is high school juniors who are ages ranging 15 to 17, and they will complete this Beck's Depression Inventory on day 1 and then the final day of the project to really see the differences COPE has made in their lives. It is hopeful that this project will lead to many more studies and projects in the future involving COPE, so this can become consistent and implemented in all high schools to really help with this depression issue in adolescents. It is also in hope that COPE can be used in outpatient settings as well for any teens that display these depressive symptoms. Advanced practice nurses can really help encourage COPE by showing schools and health departments the great results of this method and using it in their own clinics.